Pancreatic cancer, right. It's one of those things, I mean, it's scary. Everyone's kind of nervous about it, you know what I mean?
Yeah, and for good reason, honestly.
That's good reason.
One of the toughest things about it is we're still figuring out what causes it, what makes it worse, the whole 9 yards.
Exactly, and that's where this study you sent comes in. It's about diabetes. And we always hear about diabetes increasing the risk of getting pancreatic cancer, but
Right.
this goes a step further, doesn't it? Like, what happens after the diagnosis if you already have diabetes? That's not something you see studied as much.
No, you don't, and frankly, it's a huge deal. Pancreatic cancer survival rates are already rough, so if diabetes is making that even harder, well, we got to figure out how.
Absolutely. So break this study down for us. How do they even go about researching this?
So they did what's called a prospective cohort study. It's like a fast-forward button on a bunch of people's lives, see what plays out over time.
Okay.
This one, they used data from something called the PLCO Cancer Screening Trial. Huge study, over 150,000 people.
Wow. Okay, so we're talking massive data set here. That's got to help with getting solid results, right?
Absolutely, yeah. Bigger the sample size, the less likely it is you're just seeing some random fluke. Out of all those people, though, 504 of them, they developed pancreatic cancer while the study was going on.
Okay, so those 504 cases, they zeroed in on them specifically. What was different about how they looked at those cases?
Here's the key, and this is why the study's so strong. They knew about the patient's diabetes from the start, before there was even any cancer.
Oh, interesting.
Yeah.
So they could see who already had diabetes going into it and then see how the cancer played out. It's not like they were trying to piece it together after the fact.
Exactly. That's so important with something this complicated, right? Diabetes, cancer, you want to, sure, it's not just correlation. You want to get as close to causation as you can.
Makes sense. All right, so the part we've all been waiting for, I'm sure. What'd they find? Did having diabetes actually change how these folks did with pancreatic cancer?
Well, when they crunched the numbers,
Yeah.
there was a pretty clear pattern, actually.
Yeah.
People with diabetes, they just didn't tend to live as long after that pancreatic cancer diagnosis.
Okay, but how much shorter are we talking, really? Because I feel like with something like this, even a few days is a big deal, right?
Oh, absolutely. Every day matters with pancreatic cancer.
Mm-hmm.
They found the median survival, so like the midpoint of everyone in the study was 92 days for the folks with diabetes
Okay.
versus 139 days for those without.
So that's, what is that, almost 2 months difference?
It's a significant difference, yeah.
Wow, okay. And I know they didn't just stop at that, right? Like, they dug deeper to be sure it wasn't just some random thing.
Oh, yeah, very thorough. They controlled for all those other things that could mess with the result. Age, whether someone was male or female, race,
Yep.
even how far along the cancer was when they caught it. And even then, even accounting for all that, the link between having diabetes and shorter survival, it held up, still statistically significant.
So that's kind of huge, isn't it? It means this connection they found, diabetes, pancreatic cancer survival, is pretty strong, not just explained away by something else.
Exactly. Now, to be fair, this kind of study, it doesn't prove diabetes is making the cancer worse, like it's the cause.
Right, right. Correlation, not causation, that whole thing. We always got to remember that.
Exactly. But
Yeah.
it's a big red flag, right?
Yeah.
Really suggests that diabetes might be playing a role in how aggressive the cancer gets.
Yeah. Makes you wonder, what is it about diabetes that could be doing that? Is it like the way the body handles blood sugar, it somehow helps the cancer cells grow faster?
It's a great question. And honestly, it's what a lot of researchers are trying to figure out right now. This whole connection between metabolic health, which includes blood sugar and all that, and how cancer develops, it's a hot topic.
This is making me think about something I read actually about metformin. It's that common type 2 diabetes medication. I swear I saw something where it actually helped some pancreatic cancer patients, survival-wise. What's the deal with that?
Fascinating, right? And it just goes to show you how complex this whole thing is.
Yeah.
Metformin is definitely having a moment in the pancreatic cancer world. Lots of folks looking at if it could be a treatment option. Maybe by itself, maybe alongside other things.
Man, so many layers to peel back here. Okay, before we get too far down the rabbit hole, though, any study's going to have its limits. What should we keep in mind about what we don't know from this research? Man, so many layers to peel back here. Okay, before we get too far down the rabbit hole, though, any study's going to have its limits. What should we keep in mind about what we don't know from this research?
Yeah, you're right. No study's perfect.
Yeah.
Got to be aware of the limitations. In this case, like, they relied on people remembering their own diabetes history, right?
Oh, okay.
And that's not over.
We're not always perfect.
No, exactly.
People might not be able to pinpoint exactly when they were diagnosed or how well they've been managing things over the years. What else did they not know?
So they didn't have a complete picture of all the different treatments everyone got,
Yeah.
And pancreatic cancer treatment, it's not one size fits all. Could have played a role in those survival numbers too.
So almost like more questions than answers. But that's kind of how good research works, doesn't it? Opens up even more to look into.
It does. It's a stepping stone, this study. Important piece of the puzzle, but definitely not the whole picture when it comes to this diabetes and pancreatic cancer link.
For our listener who sent this in then, what's the big takeaway for them? What should they be thinking about after hearing all this?
For me, it really hits home how important it is to look at the whole person when we're talking cancer. Right. Treatment, outcomes, all of it. Can't just focus on the cancer itself. Someone's overall health, other stuff they're dealing with, like diabetes in this case, it matters.
Hmm.
Could be playing a role we don't even realize yet.
It's that whole everything's connected idea.
Exactly. And the more we know about those connections, the better we get at preventing these things, treating them,
Yeah.
everything.
Well, I always love a good medical mystery, and it seems like this is a big one. Thanks for diving into this with us. Really shed some light on a connection I don't think a lot of people are aware of. Gives us all something to think about.
Glad to do it. Until next time.